Hi everyone, today we will be discussing cupping therapy. In my group there is myself, Sophie, Pablo, Simon, and Sem. So what is cupping? Cupping therapy is a form of alternative medicine that has been practiced for thousands of years. Skin is prepared with oil, lotion, or alcohol, and special cups are placed on a painful area or an acupuncture point for a few minutes. This creates a suction effect with a pump or a fire. The different types of cupping include heat cupping, dry cupping, and wet, which causes bleeding. Some benefits of cupping therapy include pain relief. It also relaxes stiff muscles. It's used for detoxification and relaxation. How does it relieve pain? Cupping improves local blood circulation. The suction and negative pressure provided by cupping can loosen muscles, encourage blood flow, and calm the nervous system. It is believed to reduce discomfort in the target tissues by stimulating inhibitory neural pathways. In this way, cupping may create a counter-irritation effect that temporarily increases pressure pain thresholds. Some side effects include circular marks that can last up to 3 weeks, lightheadedness, dizziness, sweating, nausea, infection, and superficial soreness. Now Simon will discuss the contraindications.
Some contraindications that if you see you do not want to continue with treatment are skin ulcers, high fever, convulsions, cramps, if there's pregnancy, if there's burns in the treatment area, infections, bleeding disorders, or cardiovascular disease. You would not want to perform this treatment. Next, I'm going to discuss one of the articles that talk about effectiveness of cupping therapy on chronic neck and shoulder pain patients. Research was done in the form of a randomized controlled trial to determine the effectiveness of cupping therapy on relieving chronic neck and shoulder pain. The article answered the clinical question, will cupping therapy result in effective pain relief without adverse effects in patients with chronic neck and shoulder pain? The type of study done was a randomized controlled trial, and the article was published online March 17, 2016. Some institutes that were affiliated with this study is the Institute of Medical Sciences in Tsuchi University in Taiwan. The next is the Department of Nursing at Tsuchi University of Science and Technology, also located in Taiwan. Inclusion criteria for participants of this study were people that worked at least 40 hours each week. They suffered from work-related neck and shoulder pain that continued for at least 3 consecutive months, and the intensity had to be at least 3 on a scale of 0 to 10. The exclusion criteria, where participants were not included in the study, were infection, injury, or bleeding of the skin surrounding the area for cupping therapy, if the patients had neuropathy in the cervical spinal cord, or if they ingested any analgesics within 4 hours preceding the experiment. If the patients consumed coffee, tea, or any other caffeinated beverage within 4 hours prior to the baseline measurement, they were also excluded from this study. No tobacco products were consumed for a minimum of 30 minutes before cupping therapy. The total number of participants in this study was 60 people. 30 people were in the experimental group that received cupping therapy, and 30 people were in the control group that received no therapy. The participants that were in the experimental group that received the cupping therapy were seated with their neck and shoulder regions exposed. The cupping therapy was performed by igniting an alcohol swab and placing it inside the cup and withdrawn. This is known as PHYR cupping therapy or heat cupping therapy. The 3 cups were placed over the patient's lower cervical extensors and on their upper trapezius muscles for 10 minutes on each side of the patient. The average age of participants was 43.5 years old, and there's an 8-year difference between the oldest and there's actually a 16-year difference between the oldest and the youngest participant. Results of this study showed that cupping therapy mimics an analgesic effect, which has no negative side effects. Another result of this treatment was that cupping therapy is shown to increase skin surface temperature and decrease systemic blood pressure. And the final result gathered from this study was that patients' reported neck and shoulder pain was decreased post-treatment. Limitations of this study include Cupping locations were limited to areas specific to acupuncture points, and other skin areas were not explored. And another weakness of this study, most of the subjects were female. There were very few male participants that met the inclusion criteria. Next, we're going to have Pablo discuss another research article that talks about the effectiveness of dry cupping versus electrical stimulation therapy on plantar fasciitis.
So the second study that we used, again, that discussed the difference between dry cupping and electrical therapy on plantar fasciitis, basically stated that research was done to determine and compare if dry cupping and electrical stimulation helps decrease pain levels and improve functional mechanics of the foot and ankle for patients with plantar fasciitis. The article answered the clinical question: will cupping and electrical stimulation help patients decrease pain and help with functional mobility of the foot and ankle in patients with plantar fasciitis? 29 participants were used on the study, ages between 15 and 59 years of age. It included 9 males and 20 females. The study was done randomly between two groups, dry cupping and electrical stimulation therapy groups. The research study was a randomized controlled trial, and treatments were given twice a week for 4 weeks. They tested the outcome measurements by visual analog pain scale, at rest, first thing in the morning, and with activities. They also used the foot and ankle ability measure to analyze the ankle and foot functional mobility. Dry cupping was applied to the painful site for 10 minutes each treatment. The amount of pumps was depending on the tolerance of the patients. Electrical stimulation electrodes were placed around the painful site on the plantar surface of the foot. They used the ICF setting to control pain. Frequency was between 80 and 50 pps. Pulse width was between 100 and 125, and duration time was 10 minutes. According to this study, dry cupping therapy decreases pain by promoting blood flow to the site of injury, whereas electrical stimulation therapy decreases pain by stimulating the A-beta sensory fibers and decreasing nociceptive inputs to the brain using the gate-controlled theory. The result of the study shows that both dry cupping and electrical therapy helps decrease pain and increase the functions of the foot and ankle. The study also confirms that both of these modalities should be used with patients that present with plantar fasciitis. The limitations of the study was the small number of participants that were used, diversity, and the age of the participants were mostly young. Now, Sim will be discussing about the exercising with cupping therapy.
Exercising with cupping therapy. There are many exercises that can be incorporated into cupping therapy to enhance the effectiveness of treatment. Some of these exercises are cat-cow, bird dog, wall crawls, and functional exercises and active range of motion stretches. On the bottom of this slide right here, you can see two videos. The first video is regarding a functional exercise of shoulder internal rotation, and the second video pertains to cat-cow and bird dog exercises with cupping therapy. Exercises during treatment may further increase blood flow, increase range of motion, and increase pain threshold in areas of restricted movement. Sensations you might feel while exercising with the cups are tightness of the skin involved with treatment and slight uncomfortable pulling restriction of the dermis. Cupping placement. Procedures of dry cupping are: operator places the cup in desired position, inserts the pump into the valve, and then proceeds to pump air out of the cup, creating a suction. The strength of the suction can be adjusted from the valve, which is positioned at the top of the cup. With this method, the operator has absolute control over the vacuum, in particular when sensitive and small areas such as facial points are involved in this treatment. Here you can see on the slide are some of the vast majorities of lists that we can find online and a hyperlink that includes additional information in areas of treatment. Cupping therapy demonstration is provided in this video in conclusion. In conclusion, based on several articles, cupping therapy is an effective method to decrease pain, increase blood circulation to specific areas without the use of drugs. However, there's still a lack of scientific evidence supporting benefits of cupping therapy, and further research needs to be done. The video up in this PowerPoint slide will show you what a pistol grip dry cupping is like. Thank you for your time, and we hope that this was educational and fun for you, as it was for us.